get from them too.
Well, does somebody want to take on that project?
Hire somebody?
Dr. Stowe said that they spent $25,993 to have that study performed. I don't know what that's going to cost in 2012. And even, the scope that would need to be used for the study. I mean, there's lots of different factors that go into that, and that's not a project that I'm interested in taking on. I've taken on plenty already, and if one of you wants to do that or can volunteer to do that and come back with some information that might be useful at our next special meeting. And by the way, there was an email that went out, I think, late this afternoon asking for you to check your calendars to see whether July 9th, 10th, or 11th would meet with everybody else's calendar from availability standpoint. It's a Monday, Tuesday, and a Wednesday in the second week of July for our next special meeting. I think that we're going to need to have these in July and more likely in August prior to our September meetings in order to get everything done that we want to get done. So with that in mind, I mean, I'm open for, number one, what date is going to be good for our next meeting, and number two, if somebody want to spearhead the project of trying to determine what our cost might be if we're going to authorize this study.
Mr. Chairman, we do have that $294,000.
That's not the point.
No, that's not the point. But we do have money available that has not been allocated.
Sure. I don't know that it's not been allocated. I think it's eventually, we cover our operating costs and the remainder goes to the providers, but it may be unspent as of now.
No, that's when I communicated with Pat, that wasn't what she explained to me, that our budgeted expenses have been taken care of. The $294,000 is what we have over and above.
Yeah, I think we may have collected a little bit more than what was originally budgeted.
Right.
The late fee, late payments.
Yes. Can I say one more thing? To go back, I'm not sure what I heard you asking. Were you asking for a volunteer to maybe look around and see if there are companies available to do a study for us?
Yeah, like the group that was out of Gainesville. I mean, I don't know if it was University of Florida related or not, but if there's some organizations out there that somebody can contact and find out if they can do such a study, maybe even provide them a copy of the one that was done in 1993 and say, can you duplicate something similar to this, and give them an idea of what we're trying to accomplish. In the time frame and a dollar amount or an estimate, they wouldn't necessarily hold their feet to the fire, but they would need to be in the ballpark of what it would cost. I would think that would work.
Well, I wouldn't know where to begin, but I'll sure volunteer to do it. And I also wanted to mention that I also looked at C10, which is a healthcare access network, a primary care access network in Orange County, and they have provided care to, of course, they're only covering 125% of poverty, but they have provided care to over 100,000 people through this. They did it for $6 million for primary care and $6 million for secondary care.
Okay.
Mr. Carpenter?
Yes.
As to the date, I've heard from everybody but Mrs. Boehner, Mr. Brown, and the majority so far has said 10th.
That's a Tuesday?
Yes, sir.
Okay.
So Mr. Brown and Ms. Boehner available?
I can make that work, I hope, Tuesday.
Mrs. Boehner, are you available on
July 10th, are you saying?
Yes, ma'am, July 10th on a Tuesday. Are you available?
Yes, I am available.
Thank you.
But it was hard to hear you.
Sorry.
Got that part out of the way.
The policy procedure recommendations, Mr. Chairman, and I don't know where we want to go with what we want to allocate. I personally think trying to do a study in the next 3 months by the time we do it. I'm sorry, I got the microphone on.
We're not trying to attempt to complete the study before our September. The suggestion from the public was that maybe let's go forward with this first year of funding as was recommended, but with the stipulation that we have the study done to determine or document the indigent care need on a go-forward basis to be considered for the following fiscal year, not this current fiscal year coming up.
Okay. Okay.
Mr. Chairman, I want to, I haven't said this, but I want to thank you, and I appreciate the effort that you put into put this together. I know there's a lot of work to do that. I would anticipate that, these are just some thoughts, but I would anticipate that in the decisions we're going to have to make in September is what we need to be prepared for, and that's whether to impose a tax, what the millage rate is going to be. After that, we're going to have issues of compliance with the auditing to make sure that the statute has been complied with, the money funds for the indigent needs. And I would anticipate that anybody that desires that we impose, that a tax be imposed for the indigent is going to appear at the hearings and is going to make the request. And there's going to be a burden and obligation on whoever's making that request to provide the data themselves and information that's going to show that the tax is necessary and how much is necessary so that we can determine the millage. So I do think it's important that we, maybe to have, it would be nice to have a study. It would be nice to have, real detailed policies and procedures in place to make those determinations. I think that, that we will make, and ultimately we're going to make that determination based on those that are coming to ask. And I have never heard, in the short time that I've been on the board, I've never heard anyone other than the hospitals and live stream come and make a request for any funding for the taxing district. In fact, I've heard at least one or two other providers that came at prior hearings and thanked the hospitals and encouraged us to continue to provide the money to the hospitals because, just as we were talking tonight, the hospitals provide funds to them that are made possible by the money that's given to by the board to the hospital. So my thoughts is that I'm a little bit bewildered too on some of the things that have been said tonight. You're mentioning saying, well, let's do the minimum. The suspicion that's out there that's put on that the public and other board members want to put on the hospital because they're the hospital, and the use of words of saying this is my tax money, this is my money, and all the while saying, well, we're supposed to be doing this for the indigent, but all the while forgetting about the indigent and the people that need care in Lake County. And I think that we can get lost in the suspicion, we can get lost in these are my taxes, and we can get lost in let's do the minimum, and we're forgetting about all the people in Lake County that have needs. And I would be totally shocked. We can go do whatever study we want to find, but I'd be totally shocked to find that there's no need for this tax that's been imposed in Lake County for the indigent. It's just obvious. You can drive around Lake County now. You can look and the food banks, the churches, the businesses that we're dealing with. If you're a banker, you're a contractor, you're an attorney, you're whatever. I mean, whoever you're dealing with, that people are hurting, and it affects their ability to obtain medical care. And there's a greater and greater need today for that care. So I don't want to do anything that's going to delay or put us in a position where we find ourselves in September that we're not ready to impose a tax for the necessary amount to provide the funds that are necessary for the indigent. And those are my thoughts about it. And I don't. When does the audit have to be done on the funds that are expended? When does? If you can remind me.
Well, I'm sure it's required on an annual basis, but I don't know that we want to wait until the end of the year to do that. It was been suggested in the recommended procedures that we do it on a quarterly basis. West Volusia said they do it on a monthly basis. Is that correct? Well, I guess the TPA is doing it on an ongoing basis. you get a report from them on a monthly basis.
So do we have to audit what's been done already, under the
No, it's going to be
2011, 2012?
No, my understanding is it starts on the October 1, 2012.
So for those funds in the future, will have to be audited.
Yeah.
So, my thoughts, without requiring that we spend a lot of money to try to implement what the legislature has imposed upon us at this point in time, my thoughts is that we try to keep what we spend at a minimum, that the decisions we're going to have to make in September, whether to impose the tax and what the millage will, and what the millage rate will be, is going to be based on information that the hospitals or the providers are going to be bringing to us, that we don't need to pay somebody to go gather that information or help us to determine what information we need to have. The hospitals will bring us, or the providers will bring us the information they know that we need justification for whatever our actions are going to be. And I believe that they will bring us that necessary data. And I would prefer not to have to hire somebody to do all these things and rely on whoever's coming to ask to provide, and then in our audit, that maybe we just need the auditor would be where we would focus on spending the money.
Right. That's what I recommended or suggested, that I can contact the two TPAs. I can contact and see if there's any other TPAs that might be interested. I'm not sure if we have enough information yet, Ms. Kirsten, to write an RFP, or request for proposal, because we really don't know what that's going to be include. We don't know what we want them to do yet. So I would think this is going to be pretty much a conversation at this point, not a request for a proposal.
I agree with Mr. Carpenter. I think it'd be difficult to draft at this point in time. I think it would be difficult to draft an RFP at this time. I think perhaps a conversation with the TPAs or any of them that are available in our area or in the state to talk to us further, give us information.
Okay. I mean, is there in talking to the TPA, I need to tell them this is what we have in mind. I mean, do we want to have a card system? I mean, is there a consensus among the board about whether we want to implement that, or do we want to just do it based on the charges and the documentation that are provided by the hospital, and audit that information?
This is the first time I've heard of the cards, so it's kind of difficult, I think, to jump on board with something that's I'm still trying to wrap my arms around. We've heard a lot of different proposals, a lot of different thoughts as it relates to all kinds of things tonight. And I think it's going to take a little bit of time to digest. We're all going to have a meeting next. Perhaps there's opportunities for more input from people who use the cards, or have had experience with cards, whether that's a really win-win situation, or there are other complications with that. I'd like to hear that before I vote on it.
I think that's a good idea, bringing a couple of people.
Well, I wasn't necessarily, sorry.
I'm sorry, excuse me.
I wasn't necessarily saying that we make a decision tonight whether we want a card system or not. Is, do I ask the TPAs to come up with, what am I asking them to come back with from a cost standpoint? Are they going to be doing the eligibility checks similar to the West Volusia Hospital Authority, or are they just going to be doing an audit? We want them to come in and look at the residency documentation and the income documentation and asset documentation, and the medical necessity and all that, doing that particular, I don't even know if they do that kind of work. I'm open for suggestions here.
Just a few comments about, maybe I can help with the card system and maybe some of the discussion about the costs that are already being borne for verification. The hospitals, keep in mind, the hospitals have to do verification checks anyway. So according to Mr. Yoakum, those checks are being done, and yes, they cost money, but that's all being done because that's how the system works now. Card system might be a great system when you have a network of primary care providers that are available in your area, or when you have a government system like Volusia County where there's government clinics there that people can bring cards to be participating. Our 2 clinics are completely free clinics, so there is no payment that's associated with that. So the card wouldn't, if they have any type of insurance, including insurance from the card program, they're not going to be able to keep their sovereign immunity under the Health Care Act. I know there's sovereign immunity in this bill, but a card system for a hospital, we take all comers. We don't get a card before we see them. So a card system is not going to provide the indigent with any hospital care. We're not going to wait to see if they have a card or not. They're going to come into our emergency room and they're going to get the care, and we might use that on the back end, but it's not going to be used on the front end. There is not a primary care group of clinics there that a card is going to be able to give them free care. It's not built, the system's not built here in Lake County like it is in those other places. The Pecan place and Volusia County, they have that system in place. So a card at this point is premature to put in place based on the type of care you're getting provided now. But again, under Florida law and federal law, the hospitals are going to provide the care that they're providing to the indigent population regardless of their card or not. So you're reimbursing us for cards. And I would point out the legislation does not say that you can't pay or allocate money for care provided in the past. It just says for care. It doesn't have a time frame on it. And I think with the concern about the hospitals getting the lion's share of the money, as long as these matching programs are in place, it makes no sense for us, and me as a taxpayer, forget about the hospital, me as a taxpayer, to watch my tax dollars not get maximized. Makes no sense to me because the money is being taxed. That tax you're concerned about being taken from the government is being taxed already. It's going to go to another county. If it doesn't come here, it's going to another county. And I hope that resonates with you, that your tax dollars that you pay, the hospital pays, will get pulled away from you and put into another community unless you go after it and match it with intergovernmental transfers, which is what you're doing. And that would be terrible to happen. I wouldn't feel right about that.
Question for Bill. When you're saying my clinic, our clinic, are you talking about the Baptist Church, that clinic?
The free clinics. They don't accept payment under the health care.
Well, they could. I mean, that's one of the clinics that I've been referring to, one of the 2, the Baptist Church and the Catholic Church in Houston.
And they would have to.
I mean, they could do that many more people. I mean, that.
All right, there's one bill of funding, and by the time you divvy it out, they'll have the problem for them will be how do they determine when they get sovereign immunity under the Healthcare Clinic Act that they get, and how do they get it under your act, and how do they cut off? Is it the first 50 people they see, they get immunity under your act, and the next 50 they don't take payment for? I don't think it's very clear in your bill. I don't think it's very clear in the way it's written that the clinics would still get their sovereign immunity if they accept payment from you. And as already has been pointed out, for Waterman, they wholly own that clinic, so they're seeing those patients, and they're providing that care, so the reimbursement is really going to them. In our case, we're funding the operations through our own dollars. We're not seeing the patient directly, but the clinic is.
With Waterman's clinic, then they would have sovereign immunity for their volunteers that work in that clinic. Because they could be
I don't know exactly how Waterman's clinic works, but.
The
patients seen at our clinic are seen by volunteers who are covered by sovereign immunity because we do not charge those patients and don't receive compensation for that care.
What would happen if they tried to pay you?
If we accept compensation for the care, then we're not, as I understand it, we're not covered by sovereign immunity.
Well, wasn't there a lot of sovereign immunity discussed during the drafting of this bill? I mean, wasn't it Representative O'Toole that just insisted that we had to have sovereign immunity there?
The legislative delegation has the ability to legislate sovereign immunity for specific providers, but this enabling legislation does not outline sovereign immunity for clinics or providers. It was something that is available if the elected officials in the legislative delegation credentials at our clinic. I think that was your question.
I just don't get it. I still don't get it.
Well, that's the problem, is that as much thought that went into the drafting of this legislation, there are lots of ambiguities, and you know, took it to a certain level, but maybe not far enough. And there's some areas that are open to interpretation, and it's very difficult to read this and know exactly what we have to do. I think we're kind of have to feel our way through this. I'm looking for the language on the sovereign immunity. I don't understand it.
Mr. Chairman, I can make a remark on sovereign immunity if you'd like.
Sure. It's just your experience with We Care.
We worried about sovereign immunity at the outset of the We Care program. However, at the time, it was going to be very intrusive for physicians and their offices, and we decided that we would not engage in sovereign immunity. And the theory at that time was that there were studies, including out of Harvard University, that the poor do not sue more. And that
Poor do what?
The poor do not sue doctors more than the average population.
Is that before Morgan & Morgan came around?
I better not comment. At any rate, the doctors have always been interested in sovereign immunity, but the fact of the business is, even if you have sovereign immunity and you are sued, you still have to go through a lot of hoops and hurdles. And most doctors today have some malpractice protection that helps them out in the event of suit. I don't know what the experience is right now with the Waterman picture in terms of their voluntary efforts, or the Leesburg Hospital. I don't know whether they have experienced a rise in the number of suits that have resulted from their voluntary care. I certainly haven't read about very many. I suspect that it's a very low rate. So I don't like to see the sovereign immunity question really blown out of proportion.
Okay. I want to read the section on page 16 of the legislation discussing sovereign immunity. It says, for purposes of sovereign immunity pursuant to section 768.28.2 Florida statutes, any primary care clinic physically located in the district, the main purpose of which is to provide indigent care, in which directly delivers that care for compensation from the district as provided in this act, and any healthcare provider who volunteers his or her services to the primary care clinic to provide indigent care without receiving personal financial compensation shall be conclusively deemed to be primarily acting as an instrumentality of the state. Now, that doesn't mean a lot to me since I'm not an attorney, but I don't know what the statute says, and I don't know what being conclusively deemed to be primarily acting as an instrumentality of the state means, but I'm assuming that means that you can't be sued, but I don't know if that's active or not. Mr. Madison?
I am clear that volunteer providers, physicians that volunteer at our clinic, would not do so without sovereign immunity. And if we compensate them for the care they provide, then I think they would, by this statute, not be covered by sovereign immunity.
Right, so the primary care, it then begs the question, because those are the two largest free clinics or primary care clinics that I'm aware of. I am aware of the one in the Catholic Church, and I think there are probably others. But I don't know if they're going to have the same issues with regard to sovereign immunity or whatever. So I don't know, how that's going to work. It might. I don't know that as an individual practicing physician, is he a licensed primary care clinic? I mean, if Dr. Pertos, if you open up an office across the street, would you have to have a license as a primary care clinic? if you were a family doctor, I know you're a night surgeon, but, I don't know the answer to that question. I don't know who would qualify. I mean, the legislation specifically states that a licensed primary care clinic doing business within the district would be eligible to receive funds. So if the two primary clinics are maybe not willing to participate in this because they think it's going to affect their ability to attract volunteers to provide this free service, if that excludes them, then who's left? I mean, are there independent physicians or groups of physicians that would qualify? I don't know the answer to that. I don't know if a doctor comes into town and wants to practice medicine here, what kind of license does he file for? I doubt it. Maybe if he's not a specialist, if he's a family doctor internist, does he file for a primary care clinic license, or does he file for a doctor license?
He's licensed at the state as a physician. He is licensed by the state to practice medicine. And that means that he can open up wherever he wishes. Now he has to get the local permits and so forth.
Right, the local permits, I think, is what maybe the legislation is referring to, not a state license. So that's the issue, is that, I don't know if that's going to, we may not have any licensed primary health specialists that qualify. I don't know. Yeah, so.
I must qualify that I don't represent any physicians directly, so I haven't set up any physician clinics. But I do believe the statute is referring to a license by the state. There is a Healthcare Clinic Act out there, and I believe any physician that forms more than one person in a group becomes a clinic under that act and has to be licensed under the hospital or the Healthcare Clinic Act.
Can you clarify that? I mean, if there's a group of internists that open up.
There is a healthcare, all I know is there is a Healthcare Clinic Act. I don't work inside that statute because I don't represent physicians, so I don't have a healthcare clinic. I don't have to follow the Healthcare Clinic Act because hospitals are exempt. But there is, I know that there does exist under Florida statutes a Healthcare Clinic Act, and maybe your attorney can look into the Healthcare Clinic Act and find out what it takes to be licensed as a healthcare clinic. I believe that's what the statute is referring to. I don't know that our primary care, I haven't looked into, I don't know if the free clinics are licensed under that act, because I think they're licensed under a different act that, again, my point to the sovereign immunity was they would have to choose whether to be covered under your act or stay covered under the current act that they provide care under. Your act doesn't guarantee them, I mean, they don't take payment now when they're operating. Your act, if they went under your act and only got half their payment, that may not be a good way for them to operate. So that was my only point on the sovereign immunity. But there is a Healthcare Clinic Act out there. To the best of my knowledge, that's the only, other than individual physicians being licensed, other licensed out there. And since it said licensed primary care clinic, I think it does say licensed primary care, right?
Yeah.
Primary care does not mean specialty care. It means primary care. So the talk about the card being used to go see an oncologist probably doesn't apply under our bill. So, I mean, there is some differences, and I don't think there is a network of clinics out there that would be eligible. And then you have to keep in mind that what for you to consider is there aren't, other than the free clinics, any that I know of that are not-for-profit. So you're talking about for-profit clinics receiving tax dollars, and I know, Mrs. Boehner, you have an issue with for-profit companies taking tax dollars, so you want to be careful with that. As a licensed clinic, those would be for-profit.
So I'm not even thinking of a licensed clinic. But I wanted to ask you a question.
But it says licensed primary clinic in the bill.
Well, I think what we should do is we should get Representative Metz in here for him to explain to us what he was thinking. I remember during
I
the
think
time...
he was opening it up for-profit or anything like any, because I remember...
So don't you think we should let him explain it? I remember at one time there, he related to me that he had visited the Baptist clinic, and I think he was probably referring to the Waterman clinic as well.
Right.
And he was so impressed with those clinics that this...
Thank you.
I agree with that. I had a meeting with Representative Metz before our last meeting in May, and he did in fact indicate that those were the two clinics that he had in mind when he included that language in the bill. And I guess he made it vague enough to where others that might come along or maybe in existence could also participate. So it may come down to whether those clinics choose to want to participate, if, for various reasons.
Right, for their current operation,
Right.
it's pretty efficient, and I don't know that they would participate. But again, outside of those, you would be talking about for-profit companies receiving these tax dollars. And Mrs. Bader, I know in your law
I
firm.
wouldn't be talking about that.
Okay, well, that only leaves, if you're talking about allocations of money, that only leaves the not-for-profit licensed clinics and the not-for-profit hospitals. If you're not talking about for-profit entities, there are no other providers out there that are not-for-profit that I am aware of. So until those become in existence, your allocation that everyone seems to be so concerned about being unfairly balanced, it's because the only not-for-profit entities out there providing this care are those entities.
Okay. I would like to ask.
Can I ask one more question?
Sure, go ahead.
You just always do that. What do you know about the 501(r)(3)?
501(r)?
Internal revenue.
We're 501(c)(3)s, so I'm not familiar with
Section 501
RC. It's the best
R3.
Again, the hospitals are 501(c)(3), so I'm familiar with that.
This
But that, to me, what that is another designation of a type of not-for-profit tax exempt entity. I don't know what all qualifies for that type of tax exemption, but it would be another tax exempt entity.
It comes under community health needs assessment in this article here.
Mm-hmm. Oh, that is, well, if you're referring to the community health needs assessments, all tax exempt healthcare entities will be conducting community needs assessments as part of their IRS requirements. We'll be happy to share.
Say that again, Phil. Say what you...
All the hospitals will be conducting under the IRS regulations. Will be conducting community needs assessments.
Okay.
And we have to disseminate those publicly, and those will be disseminated. I don't know if they meet the same.
Did we have paid for another study?
Well, I don't, I wasn't here in '93, and I don't know that study is the same type of community needs assessment that the IRS is requiring. It would be similar, but I don't think it would be exactly the same as what was.
Can you provide copies of the?
We will.
Are they done annually?
No, the requirement just got put in place a year ago. And they had, I think it was a year and a half ago, they had to get up to 3 years before you have to do your first one. We have contacted, in fact, you may want to reach out to this group. There's a Well Council of Florida, who actually helped facilitate the healthcare committee that we were talking about earlier. I sat on that committee. It was a good committee. One of the things we found was that it took a lot to do anything productive because you had to have the public meetings and all those other things. So you really, it was great to get the providers together, but as government, as we all know, government doesn't always provide us the best way to get things done. So it was very difficult to do anything. But Well Council of Florida does help needs assessments, and we're actually looking at them to help us with ours. I mean, they do them all over the state.
There's a good story for you, Ms. Boehner.
Did you say you are about to do your first one, or you have done it?
Yeah, we're about to start implementing. We're about to start doing our first one.
Because this says requires the hospital organization to conduct a community health needs assessment every 3 years and adopt an implementation strategy to meet the community health needs identified through such assessment.
Correct. And our tax year is June, July.
This is to fulfill your charitable mission.
It's part of the requirements of the tax exempt organization. Mm-hmm. And our year is June, July, so it's due the end of June 30th, 2013. So
13 or 14? 13?
13. So it's about a 6-month process, which was probably about how long it took for that one. So it would take about 6 months, and we're going to start it here soon, but it's not due to be disseminated until that June 30th, 2013.
But Waterman will be doing theirs in 2012.
They can choose. I mean, once it was implemented, you had any time after that implementation to do it, but you had a deadline of the June 30th, 2013.
So that will be prior to the next round of debate or discussion about the tax, levying the tax for the following year. I mean, is that something, that may be something we want to check into as well and see what the requirements are, see if it's going to be similar to what we were talking about, or similar to the study that was done in '93.
Yeah,
We can maybe avoid the cost and just use because it's an independent third party. You guys aren't using your own people to do this.
Well, it's a little bit of both. I mean, what it requires is you to go reach out to the stakeholders in the community. You will reach out to different demographics and economic conditions for different people, and you would reach out to community leaders, board members, city commissioners, county commissioners. You do panel interviews. You also study some of the ACA data will be studied by the independent contractor. Really does a lot of the delving into the ACA data and the information, and then we'll provide it in a report, and it gets published and disseminated through the public. I'm sure Waterman will do the same. And, it might be helpful. I don't know if it'll be exactly the same, but it's something to look at. Jeff Feller with Well Counsel Florida. Jeff Feller is a great resource, and I'm sure he'll be happy that I gave you his name. But
where are they located?
Yeah, same man.
He's been around for a while doing this stuff.
Okay.
Are they from Gainesville?
He has been in Gainesville. I don't think they're in Gainesville now. We're sure. I think they're in Tampa now. Still in Gainesville? I'm being told they're still in Gainesville.
Okay.
And Allison has their name as well, if you want.
That may be a source for us to look into, and maybe if they can come, maybe if you can arrange to have them come at the next special meeting in July and give us an idea of what's going to be included in the report. Something that we can decide whether that we can wait for those reports that are going to be created by the hospitals, or we want to go out and do one independently and spend money on it. That may be something we want to have Jeff or somebody from his organization come and speak about that. And the other thing I'd like to ask Ms. Kirsty to maybe, what was the act again? The Healthcare Clinic Act?
Florida Healthcare Clinic Act.
And see what the requirements are there from a licensing standpoint, so we can try to identify, what entities or providers other than hospitals, acute care or mental hospitals, would qualify.
And just like the hospitals are licensed under the Florida statutes, there's a section for healthcare clinics.
Okay.
But again, most of those healthcare clinics, I will tell you, as far as I know, are all going to otherwise be for profit. So just keep that in mind. I don't know how you feel about that.
Chairman?
Yes, sir.
Would it be possible to approach the two current clinics and validate their thoughts that this would not be something they would want to do, or would be something they would want to pursue our monies, just so that we would know?
Well, I don't mean to speak for Waterman, but they are their clinic.
Yeah. Mr. Madison's already spoken to that issue, but what about, and then maybe we could, go and talk to the folks at the Leesburg Clinic and get an opinion from them. But I think, again, Mr. Madison has already addressed the fact that he thinks that some of their volunteers may have an issue with continuing to volunteer if there was a...
I mean, you're asking them to start providing care under an act that's right now being constitutionally challenged again, the new bill, and also a very unclear immunity versus staying under the current act that they're providing care where they're being operated by the hospitals and getting the funding they need. So I'd be surprised that it makes sense for them to take that risk. But I can only
Don't disagree.
give some advice.
Potentially, but Chairman, perhaps I'm not far at all from the Leesburg Clinic. I'll
There we
just
go.
walk over there and...
There you go.
Yeah, we'll be glad to set up a
You
meeting.
have to get a car. I want to ask you one more thing.
I
Before you leave,
I didn't leave.
what do you know about federally qualified health centers?
I know that we have one in Leesburg that is operated by Orange County, which is one of the bad facts about how those things get handed out. I know that they take most of the profitable Medicaid business away from the hospitals. I know that while they do provide good care, I don't want to knock how they provide care, because they do provide care, but they already are provided with public funding. They're not, all their funding is paid for by the government. So it's a completely funded, which I think wouldn't fit in this act, because They do, but it's all Medicaid. It's all Medicaid or sliding scale. They do have a sliding scale, but they're backfilled and supported by tax dollars completely, pretty much. I mean, I think they get very, I mean, I don't know who else knows more about them. I know that I believe the county health department recently got qualified for as a look-alike one. But what that does is they're able to draw federal dollars now for those clinics. But like I said, the one in Leesburg is actually operated by a board in Orange County. Somehow, I don't know how that happens, because they're supposed to, as also known, they're supposed to have, their boards are run by people who actually get treated at those clinics, and so they're supposed to have members from the place they provide, but that one doesn't. That I'm aware of.
Okay. Thanks.
Okay.
Did somebody else down there have a comment? All right. Well, it sounds like maybe we have some direction. I'm going to contact the TPA, maybe talk to you guys and see if there's some other sources that we can contact about actually providing the audit service. I'm hearing that maybe the card system, maybe not. I'll throw that out there for those guys and see if they can give us a bid one way or the other, or give us an idea as to cost. Ms. Boehner is going to contact that entity about the study, and see if we can get him to come and make a presentation on July 10th, or somebody from his organization. Mr. Byers is going to contact the Leesburg clinic and get their ideas, maybe something, and I don't know if they're going to put anything in writing or not, but see what kind of issues they might have with compensation with regard to the sovereign immunity issue. And Mr. Madison, if there's something that you guys can put together with a statement as to your position with regard to your clinic as well. And Ms. Kirsty's going to research that Healthcare Clinic Act and give us an idea of what other providers other than the hospitals might be able to receive funds under this new legislation. And I can't think of anything else unless someone can remind me. But Mr. Byers?
I just want to redirect to the gentleman from West Volusia. Thank you for your patience in sitting through this. You're
really front row. We're used to it.
A couple of redirects on the thought. I think there was an implication that y'all were issuing the health card out of your office. That's not the case. It is the TPA. And does the TPA now, when they get you that card, is there a photo on that card?
We don't know.
Okay.
I would think no, but I don't know for sure. And it doesn't mean, just because they don't with West Volusia, doesn't mean that they can't. That would be something to ask the TPA.
Thank you.
Is this a copy of the card and Exhibit B? It's not a photo on it. It says WVA Health Card Program, the member address. And it looks like it has a front and a back, and it doesn't look like there's a picture. Okay.
On the card situation, certainly appears what the gentleman said earlier, it may be frivolous, and I do get concerned about that. That often gives people incentive or entitlement per se to have a card. There may be a lot of wasted healthcare visits that don't need to be done. So it's not necessary. It's certainly something we want to pursue. And if the gentleman's correct on what you said earlier, it may not be. So I'm exactly want to go.
Okay. Is there any other business to come before the board?
Mr. Carpenter?
Yeah.
Don't shoot me. In regard to the website, we do have a website that's up and running.
Thank you.
It does have a notice that's published of the special meeting, and if there's other information such as resumes about the board members that the board wants to submit, I think initially they discussed giving it to Mrs. Famous. I just need to know directions if they want to give it to me or whomever to get it to the webmaster.
I think we wanted to get the names, and we have email addresses as well that have been set up, so maybe we could get those issued out to everybody. So, did you get that, Mayor, with the email addresses that everybody has?
I have the email address addresses that I use when I distribute all the information to everybody. I need to know if that's the email they want publicly posted or not.
No, we got email addresses through the website.
Oh, I did not get that.
You didn't get that
No,
one?
I did
Okay.
not.
I'll send that to you, so you can get
Okay,
that around
thank
to
you.
everybody. And then I guess just, we were just talking about just basic information of, I think, I don't have my notes with me, but before we had talked about how long you lived in Lake County and,
Education.
education.
The memo said occupation, education, birthplace, length of residency in Lake County, if that was going to be
That's it.
provided to me.
That's it for me.
I'll send you an email.
Yeah,
if
send
that's
us an
okay.
email, remind us of that.
I will.
We'll take care of that. Okay. With regard to the website, are we, I guess we still don't have anybody that's identified as being the one to update it, to upload the documents. We've identified the documents that we don't want to have on the system. I mean, that may be part of the overall admin decision, whether we have an employer or an employee that's going to do that. There actually have been, some folks that have offered to do that on our behalf. If there's not, some claim of conflict of interest, although I don't think there would be, if we're telling them to post minutes and audit reports and that type of thing. I don't think there's any way they can alter them in any way, shape, or form. So I think we have that on the table. But again, I'm glad that that's up and running, and it's something that we had to do for the new legislation. And thanks Bob for his efforts for getting that done. So with that, anybody else, any other business to be discussed? If not, meeting adjourned.